as well, and then we will open the floor up to questions for the three dogs. Just be mindful that they may not be able to address something very specific to your situation, but general questions are very good. And also, we can also open it up to patient questions, caregiver questions, and things afterwards if people want to sit around and have questions as well. But, I'll just hand the mic over.
Yes.
I have a question about where seizures come in with POTS, mast cell, and EDS. Part of my issue is because I don't sleep, and then if I lose a few hours, then I have seizures. So I'm wondering where that plays in.
Yeah, that's a complex issue. Obviously, we'd have to do a history and exam and really delve into that to understand it better. But epilepsy is a separate disorder from POTS. Now, it is true that POTS patients will have spells of collapse. They may, and if they faint, the old literature shows that up to 95% of young people, when they faint, will jerk. And we call that convulsive syncope. So it could be one of those things. It could be something else. But in general, epilepsy and POTS are not linked.
I read that somewhere, and that's why I asked about that.
But the collapsing episodes can look like a convulsion. Yes. Any other questions? Yes?
Can you repeat the questions next time?
Sure. So the question was...
I got the gist now.
Okay. Should I repeat your question? Okay. Got a nice strong voice over there, so I don't need to repeat that. Any other questions? Yes?
This is for Dr. Weinstock. How does the mast cell affect the liver, other than obviously showing up in blood tests, but how does it affect the liver?
So in severe cases, there's been cirrhosis, portal hypertension with ascites, fluid in the abdomen. That's extreme. But liver chemistries are increased, and cholesterol metabolism is a function in the liver, and high cholesterol has been associated with mast cell activity.
So,
and then let me just say, 2 separate studies have been done, and increased liver chemistries were found in 40% of both groups, one with 40 patients, one with 420.
So Dr. Weinstock, I often have patients tell me about massive shifts in their volume, swelling. Do you have any appreciation, understanding of that? Is there a mast cell connection there?
Well, we're going to find out in Brad if I'm allowed to say that. I mean, Brad has showed the pictures, but of the abdominal, but he also found that there was swelling at times around his head, neck, upper chest, and that went away with STL therapy. Maybe what's happening there is that we're treating dysbiosis, abnormal bacteria, which is stimulating T cells, B cells, and by taking that away, we're decreasing mast cell activity. Because the skin, of course, is an area filled with mast cells in people who have hives as part of their mast cell activity condition.
Dr. Q, any thoughts about the swelling, or have you had patients who...
Yeah, I think, a lot of patients mentioned that fluid shifts, lower extremity. There is some hyperpods patient that have extreme vasodilatation in the lower extremity. So you can see their hand swelling up and the lower extremity swelling up. We have treated that with the POTS, with the mast cell therapy, included the ranitidine, with the Allegra. I use aspirin in those patients too. Seems to help.
What do you do with the severe chest pain that some of your patients with POTS? How do we understand that? How do we treat that?
I believe that is also because the adrenaline can cause increased vasospasm. So it can be esophageal spasm quite often, and I see that especially in teenagers. I had a girl 3 days ago came in with recurrent syncope. induced by severe chest pain. We treated it with ranitidine and got better quite rapidly, I would say. So I think that there is a strong component of esophageal spasm in this patient. I do not like to use calcium blocker, which routinely that used to be the old therapy for esophageal spasm because it can cause vasodilatation and worsen the episodes of sickle. But I think that, ranitidine is good.
What do you think?
Well, I disagree a little bit because there are two studies that just came out, and I reviewed in my talk, where they did biopsies on patients with severe chest pain. They found the mast cells, which you can only find when you do this special stain, because the standard stains don't work. So if you're seeing your gastroenterologist for something else, make sure they do the stain. And those two patients responded to MCAS therapy. So I think you get a lot of histamine as a neurotransmitter, substance P. It's painful. Now, that said, we do esophageal manometry on people, and then we see spastic, high-density, high-pressure waves, and they're not having chest pain at that time during their study. So just seeing the pressure is not necessarily diagnostic. It's always been in those patients, they get treated for visceral hypersensitivity with trazodone, antidepressants, and treating the pressures of the wave is not the answer. But in probably selected individuals, and maybe more, as we will know, you'll see mast cell activity in the tissue, and that was what you're going to aim for.
So what is your favorite treatment for patients who tell you about severe chest pain associated with their POTS and mast
Well,
cells?
now I'm biopsying them to get some histological proof of what's going on.
You're doing esophageal biopsy?
Yes,
Okay.
yeah.
What about if they have mitral valve prolapse along with POTS?
Mitral valve prolapse, that's the cardiologist here.
Well, mitral valve prolapse is associated with atypical chest pains. The best drug is obviously most of the time it's beta blockers, which we use propranolol. I've used a lot of extended release Topro also, but that chest pain is different than what we're describing. Some of this chest pain, especially young people, is very severe, very intense. I have treated some of this, since we don't have my gastroenterologist available, empirically with muscle release treatment too. But I think that it's a mixed bag, obviously.
So Anntonella, your experience has been if I may.
Sure.
So let me just summarize. So your experience has been when patients present with chest pain, particularly younger patients with POTS, you are starting first with something for potential of esophageal and secondarily for heart. So you're starting with an H2 blocker like ranitidine, and then you're going to what? For just a beta blocker?
Beta blockers, or again, sometimes I tilt them.
No nitrates?
No.
Never do a nitrate.
I never do nitrates because of the concern that I have with the vasodilatation and the possibility that actually the syncopal episode will make it worse. And certainly the idea of biopsying people and giving us a true nature is excellent. I don't think that we unfortunately can refer every single chest pain for esophageal biopsy. So sometimes, we treat the symptoms.
So we're going to take a question back here.
Dr. Kinsella, I've tried to do the Levine protocol for your recommendations, and I also have hypermobility, so that protocol, even recumbent likewise, is really exacerbated some of the joint pain and things like that. So would the next step be to get the yoga mat and the pedal pressure? Swimming hasn't helped here.
I think maybe that, so the question was that in patients who have EDS, of a lot of joint hypermobility, that doing some of these, even sitting and lying down exercises, can induce pain, or even subluxation of joints is the concern. And so where do you begin? You know, it may be time to actually consult a sports therapist and design a plan unique for you. And you know, there are a lot of very talented physical therapists out there who could help you, particularly those who have expertise in EDS. And also, if you go on the EDS website, there are recommendations for exercise there as well. Probably the safest would be some kind of swim, I would think. Something where your legs are straight, all the joints are in alignment, and you're able to kick. Maybe not so much with the shoulders, maybe with a kickboard, so you're not having to move your arms quite as much. But you know, that isn't an area that I'm a huge expert on. So there are experts out there who can perhaps help our patients with EDS. Any other questions I can't answer? Did you want to?
I have two questions for you, since
Okay.
it's hard to get in touch with you as it is with me. So number one, has anybody done mast cell studies on nerve biopsies?
I'm not aware of it.
I mean, that you've got a repository. You do nerve biopsies. That would
We
be
do skin
incredible.
biopsies.
Yeah, no,
Yeah.
but that is right. But you're looking at sensory nerves.
Correct.
So that would be fantastic to just have them do the CD1 to 17.
Where do you get your staining done?
My pathologist does it in our...
In your office?
Yeah. And your pathologist can do it here from the cell block. And it's equal cost of a normal stain. That would be a great study, because I don't think it's been done.
I'm not aware if it has.
And then, in terms of vitamins, I think a lot of people want to know what natural things they can do. Quercetin's a non-vitamin, it's an herb that I use quite a bit, and it's a lot less expensive than cromolyn, and maybe less. You may be equally effective. You had vitamin D in the mast cell reviews. It's B6, B12, and C. And D certainly is important for inflammation and autoimmune conditions. Did you get that from experience, or have you seen vitamin D published?
So I have seen it published. The Mayo Clinic group, particularly Brent Goodman in Arizona, does vitamin D and C. Am I aware of data supporting its use? I'm not. I should just caution you about pyridoxine, that's vitamin B6. It is a common misconception that all B vitamins are benign. You can't take too many because it all goes out in your urine. But in fact, B6 has a toxicity syndrome. It causes a neuropathy. Once you get above, we generally don't recommend more than 25 milligrams a day, and that is a big dose. But there are some people, as you know, that if a little is good, a lot's better, right? So who tend to overdo things. And there are those people who take 100 milligrams a day, within 6 months develop a severe peripheral neuropathy with burning and unsteadiness on their gait. And there are some people who even took 1,000 milligrams of pyridoxine, and even over the course of 3 days of 1,000 milligrams, develop a severe neuropathy. So I would caution you about overdoing certain vitamins, particularly B6. But, so Dr. Weinstock raises some good issues about supplements, about dietary things. These are things your doctor isn't asking about, but it's important that you let them know, particularly if you're on things like fexofenadine, Allegra, which does have some drug interactions with some of your other prescription medicines. And so, yeah, anyway. Any other questions about, you want to add to that?
Yeah, I just wanted to say that unfortunately vitamin D deficiency is a very common phenomenon independent from POTS or other autonomic dysfunction. So it's very undertreated, and I think that a lot of internists, unless you're old, don't test for vitamin D deficiency, and we tend to spend a lot of time inside and not outside. So it's one of the tests that I do, and if the levels are significantly low, I recommend people to get on vitamin D and then retest, and then maybe put them on a maintenance dose, especially women, because then if you have EDS and then you get osteoporosis and other issues, then the mobility becomes even more of a problem. and the fatigue, as well as, bone pain.
Any other questions? Yes.
Dr. Weinstock, are you currently taking new patients?
Yes, but there is a wait to get in, and I am, but I'm the only one in my practice that sees patients with POTS and mast cell disease.
And thank goodness you're here. It happens.
Pediatrics?
18 and up, 17 and up on a good day.
I was diagnosed with POTS 10 years ago by Dr. Q. And it took 3 years before I was referred to her to even be diagnosed. Now I have fought this illness for this many years. And now I have developed Sjogren's, and I have developed lupus, and I'm RA, and I see the rheumatologist here, and I take 50,000 milligrams or whatever it is of vitamin D every week. How do I know when I should be tested for, and I have EDS, so how do I know when I should be tested for other things that can be developing that I don't even recognize yet? And I live alone now. My caregiver passed away this year. So, my sister is my caregiver now, but she lives off-site. I'm at home alone. So I feel like I'm going to my doctors, and I'm like, helpless. So where do I start when I listen to all these things that I say, yeah, I do that, yeah, I have that. And it's like I come to these seminars every year, and all I do is walk away going, crap, I gotta get tested for more stuff now. I mean, Dr. Kinsella, I see you for my migraines, and we do the Botox, and we do the Topomate, or whatever it is, and I take all that stuff every day, and I got a headache now. I mean, what is this?
Yeah.
Where does this end, and does it ever end?
Yeah, so I really thank you for that. That is just straight from the heart, and I feel for that, and we all feel with you, suffer with you. The enormity of, we are now in an era of medical complexity where we don't have a one-size-fits-all answer for all your symptoms.
We're all odd man out.
Yeah.
I mean, we're all in the puzzle, and none of our pieces fit
So
together.
that's why focusing on what can I do to feel better right now. Because once we start to worry about the fact that, oh my God, I'm never going to get better. Once we start to say, I'm only getting worse. Once we start to say, nobody knows what the hell's wrong with me. That's what leads to decline. And so we have to fight that. We have to fight that message that worst angel of our nature on our right shoulder is sitting in our ear. And that's a big part of winning. We got to get our mind right while we're getting better and continuing to remain open to new therapies, new discoveries. Dr. Weinstock, you want to add to that?
Yeah, I would say, we're living in a world of 8,500 toxins that we were not exposed to 100 years ago. And I think we're seeing many more autoimmune conditions, and of course you've listed all the autoimmune conditions. I recommend a book called the LDN book through Amazon. We have to control our T cells that are activated by toxins, and so I think that's very important. And there's an excellent conference that I would recommend going online to live stream called the LDN researchtrust.org. So ldnresearchtrust.org, we just had our yearly conference, and some of the speakers talked about autoimmune disease and how you can utilize your own endorphin system to squelch some of the inflammatory diseases. And you can look at diet and see if there's a way to improve diet, gluten-free. I mean, I think, Dr. Kinsella is concerned about, managing your mood and mentality is important. And then if there's any other way to managing your inflammatory system, to prevent further autoimmune conditions or control them is really critical.
All right, well, thank you all very much for your attention. It was great. Did you want to add anything?
No.
Okay.
No, thank you.
All right.
Thanks again. And let's have a big hand for gratitude.